want to welcome you tonight. We are going to be dealing with women health issues, and I'm so excited to have this wonderful panel with me tonight. I have Tanya Flanagan, I have Dr. Ortis Wells, and Shaniqua Hawkins, who are going to be with us tonight. And they're going to answer some questions, and we're going to have just a discussion. So I want you to make sure you share this. Tell another woman to get on. I want you to really stop and do that, because this is vital information about living a whole life that's full of good health. So let me just go on and start with Tanya. Tell us a little bit about yourself.
Well, first of all, thank you for having me here, First Lady House. I am Tanya Flanagan. I've been in Las Vegas about 25 years, and I was diagnosed with breast cancer 3 different times, and after the 3rd time, I decided to volunteer and find a way to give back, and that's when I began working with Susan G. Komen, Nevada. So I do that, and then I work for Clark County in communications, and I've been a news reporter and worked in gaming, so just done a lot of different things and been blessed over the years to have some amazing opportunities. And it's just a pleasure to be here today to talk about the importance of women's health and being in tune to our bodies for the good of ourselves and our families and our communities. So thank you for having me.
Oh, it is such a pleasure to have you, and just to know you survived is huge. So thank you for saying yes. Dr. Ortis Wells, would you tell us a little bit about your practice and where you come from?
Yes, well, thank you again. As Ms. Flanagan also stated, I don't even know how to follow that up. A 3-time breast cancer survivor. My name is Orlandis Wells. I'm a board-certified OBGYN. I'm from Tallulah, Louisiana, if you hit a little twang. I'm a Southern Belle, not a Belle, but that's a woman. But I have a private practice in Henderson, Nevada. I've transitioned my practice a little bit from just benign, just routine OBGYN to more of a specialty of hormone replacement therapy to help women, breast cancer, and these other challenges to not be able to feel like their lives not complete and whole. Just I'm into the whole wellness type of thing. So that's basically what my life is about. A world where a woman, when she's better, everybody's better. So keep women healthy by all means.
Thank you, thank you. And Shaniqua Hawkins, just give us a little bit about who you are and the field that you're in.
Yes, ma'am. And thank you again, Dr. House, for allowing me to be here today. Again, my name is Shaniqua Hawkins, and I am a board-certified family nurse practitioner. I do own a medical practice in the north side, actually, and it's called Care with Purpose Medical Center. And so my goal here in this space is to do our best to restore health care and to bring healthcare back into the communities and bring, quality health providers into the community so that people can actually identify with, healthcare providers and feel safe, comfortable, and have that relationship with quality healthcare providers. I really want to create this platform for family nurse practitioners, because a lot of people don't know what we are and they don't know what we do. But if, in fact, we can expose family nurse practitioners to be the quality healthcare providers that they are, then we've done our job, right? And so I'm a natural educator, and I love, doing what I do in regards to primary care, because I believe that's the start of a lot of things that we'll speak about today.
Great. And you know what? I think in our community, and we're not knocking anyone else's community, but people of color are not prone to go to the doctor like they should and get the proper checkups that we should until we discover something in our body, and all of a sudden we're not feeling well. And then when we discover we're not feeling well, and we finally say, maybe I need to go to the doctor. You know how we wait till the last minute when we could have prevented it.
Of course.
And so, Shaniqua, I hear you say about education and training, and it would be a wonderful thing, and we could talk about that afterwards, is maybe setting up something where we could find out what type of training and schooling someone might need and to educate our children that this is another profession to do. So Dr. Wells, let's talk about you and what you do. What's the #1 health issue you find with women?
Well, being a OBGYN, the #1 health issue I find with women is that they don't come, like you said, till it's too late. But I'm more into the preventative care, and a lot of things it's not that they don't come. We have a problem with access. You said, and there's another problem we have is we don't trust the healthcare field, and because there's not a lot of professionals that look like Shaniqua and myself, and so sometimes that proximity that you look like me, so maybe you care about me. So that I think that has something to do with, there's a lot of disparities, unfortunately, in healthcare. And I do see it in my practice. They say, oh, I was so glad to find a black doctor. I usually like a female OBGYN, but I saw he was black, and I was like, okay, well, all right, well, you know, I'm actually brown, but it's okay, right? I say, but they say, but it's just a comfort level. And I think, so what I find is, in my practice, I notice that when I talk to them, they feel like I'm being heard, I'm being listened to, I feel comfortable, I think you really care about me, you're gonna take care of me. So that's the big thing I find in my practice, that they're not following up because they're afraid and they don't trust a lot of people. So that's the big issue I see that I have to deal with in our community, just getting them to trust and open up.
Now, a question, since we're there and we're talking about women,
Yes.
how often should a woman really have a pap smear?
Okay, those, Dr. House, they change it, seem like every quarter. They change it seem like every quarter. It's so hard to keep up with it. The latest recommendation, and a lot of things, like I do my practice, I go through a litany of things when I see a woman for a well woman visit. So, but the main thing we know about is the pap smear, the annual checkup. It's not annual anymore. If you're a woman from 21 to 29 years of age, the current recommendation is you have a female check every 3 years from age 21 to 29.
Wow.
Once you hit 30, then there's something called HPV, which human papilloma virus. That is the one, the virus that causes cervical cancer, which is what we're screening for on the pap smear. Now, these recommendations for average risk people.
Okay.
So, but from 30 until they say 64, depending on who you listen to, from 30 to eternity, then you can do it every 5 years, as long as you get the cytology, which is the pap smear alone, and then you add the HPV testing to it. So you can actually spread it out every 5 years. That leaves us OBGYNs in the loop because anything can happen within that 5-year mark. So, but that is the current recommendation for pap smear testing. Now, for mammogram testing, it's new again. It used to be age 40, and you do it every year, or every other year until age 50, then you do it every year. Now, currently, it's between ages, they recommend you start no later than 40, as early as 45, but no later than 50. And you don't have to get it done every year, it's biannually. So every 2 years, I know it's not common, but that's what the Health Preventative Service Task Force recommends.
It's all about the money.
It's all about the money, right? And then at age 50, average risk, then you should do it annually until age 74, they recommend now. But most women, that's what they recommend. But I tell women, you do it as long as you feel comfortable. But you have to sit down and discuss risk factors.
Absolutely.
But increased risk, if you increase risk, then throw those recommendations out the door.
Right.
If a young adolescent is very sexually active, multiple partners, or her partner has multiple partners, or things like that, then you may want to start before 21 or 20. I've had them start as early as 13, 12 or 13. I delivered a 13-year-old, right, a baby. So, but then as your risk increases, breast cancer risk, if it's a mother and your mother's sister, not your grandmother, but it has to be your mother or your sister, those are first-degree relatives, you're at higher risk, not your auntie, but then you screen a little bit sooner. And mammogram is the sine qua non, as they call it. That's the go-to. But I personally like thermography. I know that's not, I don't know if I'm going to get banned from YouTube or whatever you for saying that.
No, go be yourself.
But thermography, I found, is a better marker. There's less radiation. There's no squishing and Play-Dohing, I call it Play-Dohing, with a woman's breast. So I know this how I am in my page. I try to make health funny so they keep coming back. So so if thermography lets you know 8 years before you see anything on mammogram. It lets you know it's 8 years prior. Yet it's not recommended, but it's non-invasive, is more accurate, more sensitive, more specific, and it can pick up a tumor 8 years before you ever see it on the mammogram, even before you feel it.
Wow.
So I lean my patients to thermography. It's just it's heat sensitive. It's like a camera, and it checks the blood flow in your body. So wherever there's increased blood flow, doesn't mean it's cancer. It may be inflammation, but it'll let you know, hey, you need to go look in the spot. There may be something to worry about before a mammogram shows.
So say that again.
Ther. Thermography. I hope I spelled it right.
Yeah,
okay.
Thermography. Yeah,
Thermography.
Yeah, I'm a big fan of thermography.
If you're watching this, it may be something that you can recommend when you go to your doctor is, can you get a thermography exam on your breast for prevention? You know, it's just another thing if your insurance covers it.
There you go.
And for those of you that might be privy enough to buy it, pay for it yourself, then find out how much it costs, because you know your life.
Absolutely.
What price do you put on your life?
Absolutely.
So you know what, since we're on breast cancer, you know what, Tanya?
Yes.
Tell us why you feel it's so important to be preventive when it comes to breast cancer and getting yourself checked. Talk to the women.
Absolutely, because first let's just start with early detection. We all know early detection saves lives.
Yes.
And it couldn't be a truer statement. And I say that because the earlier you find out there's a condition and an issue, the better chances you have of fighting and winning that battle. I was 32, so when Dr. Wells said, start getting exams at 40 or now 45 and do them every 2-3 years, but God, in my case, but God.
Yes.
I mean, you know, there I was, fresh out of my 20s. I know I still look fresh out of my 20s.
Yes, you do, girl. You look good.
But
So you don't look like what you've been through?
You know, don't they say that?
Yes.
But there I was, you know, in the peak, you know, career, just started in gaming, living, you know, a good life, just busy. And I transitioned from one job to another job. And if it hadn't have been just that voice in my head, my mother had passed away due to breast cancer that metastasized to her liver and her bones. We had just buried my dad's sister, who passed away from breast cancer that metastasized to her liver.
Wow.
So there I was thinking, I'm just gonna get a baseline check. And I happened to go to the OBGYN and said, can I have a breast exam? To which they said, we don't do that, but let us, given your family history, refer you out. I never thought in a million years it would come back positive. And at the time, I couldn't feel anything. A lot of times people say, oh, there's pain. No pain, no difference. Wasn't slowing me down one bit. But by getting that mammogram, in my case, I was 32. Early, it saved my life. And there were 3 suspicious areas. And if 2 of the 3 had come back positive, I was staring at a mastectomy at 32. Like, what woman, not married, no children, wants to really hear that? But I meet a lot of women, especially African-American women, who just don't want to know. Like, if I can avoid the diagnosis, I can avoid the reality. That if you're a mother or a wife or a sister, whatever, just as a person, you need to know how you're doing. So early detection is everything. Because there's so many different types, but I was stage 0. Also, as a black woman, I was triple positive. A lot of times, black women are triple negative. What does that mean? Triple negative, we know that the basic drug course of treatment does not properly attack and work on triple negative breast cancers. And while white women are diagnosed more often, black women die more frequently from breast cancer.
And you know, one thing I love that God had put on my heart through Nevada Health Centers, they have a mamma van. And so at our women's conference, we would have the mamma van parked outside so the women could get a free exam on those 3 days. And I would say every year, what I will say about the women here at Mountaintop is it was sold out. No, and you know, no openings. And so they would love, because they were meeting their quota also, let's be clear, of people of color that they needed for that. Let's be clear. But so they were like, do you need us next year? You know, so they would naturally come every year for 3 days. But I think that it's important.
It is.
It is so important. But what I also heard, Tanya.
Access, though, to care.
And women just say, I don't want to know.
That's what I just said.
I'm just saying, they would say, some women didn't even book it because they were like, I don't want to know. I had women who said, I have never had a mammogram, but because you pushed it,
I got one.
I got one. But it's like, why wouldn't you want to know? My question, let me talk, what's your fear? And whatever that fear is, we know the Bible says God has not given us the spirit of fear, but of power, love, and a sound mind. And so, ladies, early prevention for anything can help you live and not die. And so it's so important for that. And so, you know, with Shaniqua, I want to ask you, because we know we're still in the pandemic. It hasn't. They haven't told us we're out. They're just saying we're opening up. In this past year, what have you seen and what have you experienced with COVID-19?
Well, I just really want to piggyback off of a little bit in regards to what Tanya said in regards to fear. I honestly believe that a lot of us as Black women fear the diagnoses because there's a lack of access, right? And when there's no access, then that's when we start to think,
Yes.
am I going to make it, right? So if we can open up that space for Black women to be able to help them with quality care and provide the access, then I think that we'll see more patients and more, Black women come into the providers at number one, care. But number two, you know what? Let me help you, walk you through this process and get the people that you need on your team if, in fact, you come back positive, if, in fact, there is a malignancy. So I really wanted to just, say that
Sure.
because that's extremely important.
Absolutely.
What have I seen in the past year? There's been so much, but I think COVID-19 put everything else on the back burner.
Yes.
Right? So we
Yep.
still forgot about diabetes. We still forgot about colon and rectal cancers. There's so many things that we forgot about.
High
but-
blood pressure.
High blood pressure. And I'm biased because I'm a primary care provider. And, to really answer your question, what I've seen in the last year in our community is that we have really developed this high stress level when it comes down to COVID-19 and other medical conditions, because we've seen that we have the comorbidities. We have high blood pressure. We have diabetes. We have a lot of issues that haven't been resolved or that go left untreated. Therefore, if in fact we were to contract or to get, COVID-19, then that just, adds to the illness, it adds to the fear, it adds to the stress. One thing that I really think is extremely important is that we have to establish a relationship with primary care. Dr. Wells hit it on the nail. The head on the nail, the net on. I think I'm saying that correctly.
You got it.
I got it right. And so what he mentioned is that there aren't people going to, especially in the Black community, going to their primary care providers, right? You will use the OBGYN, no offense, OBGYNs as your primary care provider.
Yep.
But screening is imperative, like Tanya said, to survival.
That's right.
And so what you need to do is establish that relationship in your community with your provider, because the provider is there to guide and there to assist. And so if you can get to a primary care provider and if you can actually establish that relationship, which is extremely important, then it's that provider's responsibility then to have, the exams and these physicals that we do to actually rule out things that people are worried about. So in Tanya's case, when she said this happened at 32, and she and I actually had the opportunity to communicate about this, the number one thing that's important is history. We don't go back into the history. A lot of times, as primary care providers, because we're so busy, we're inundated with patients, and that's the part of the healthcare system that we actually need to fix, right? But when you can spend that quality time with your client, and I'm not talking about 5, 10, 15-minute visits. I'm talking about visits that talk about our history. What happened to your mother? What happened to your father? I even go as far back as your grandparents, because we do find, especially with African-American men and women, with men, we find that prostate cancer and colon cancer is really high in the African-American man, right? And so we don't address that because when we talk about colonoscopy screenings, and I don't know if you're going to get to that, I'll do my best to make this quick.
We're doing a men's health later.
Yes, ma'am. Well, colonoscopies are actually extremely important for women also.
Absolutely.
So we do find that women actually get colorectal cancer, especially Black women, at a high rate also. But we have to go back. We have to actually get the histories. We have to develop the relationships and help our clients to know, you know what, we're there for you. We're going to walk you through this. And there's access. We're making healthcare a little bit better. And so what I've seen over the years is that, especially over the year of 2020, is that COVID-19 has exacerbated a lot of the medical conditions.
Wow.
Hypertension, diabetes, high cholesterol, right?
All that.
And so because of that, I would say, get with a primary care provider. I don't care who it is.
Right.
Develop the relationship because it's important to our health and it's important for our future. And if we can see that mommy, daddy, grandmother has the relationship, then what we're doing is we're molding our children into an area of good health. I think that's what's really important.
And you know what? I call it the elephant in the room,
Yes, ma'am.
is the financial part.
Yes.
And a lot of African Americans, people of color, don't have the finances to go to see any kind of medical doctor, whether it's a nurse practitioner or primary care or OBGYN. And that's another reason why, is because how am I gonna, I can't afford another bill. I just can't afford another bill. And sad to say, and no one's really, well, I don't know of anyone that's pressuring the medical field and the medical community to provide scholarships or grants for people who can't afford the care but need the care. Free clinics with not sub-treatment, but prime treatment, you know, free medical clinics, you know, even if we had free medical, what I want to say, vans that went and serviced into the community, went to the community, set up shop, and you know, I have this vision. You know, I could spend some money, I could spend some money to help people. Let me just say that, because that's something I really wanted to do anyway. Was do a medical van, a mobile medical van that would go to the community and they would get free care.
Yeah.
Now, when you do that, now you take that out the equation. There's no reason why they can't be helped. There's no reason why they can't be screened. There's no reason why they can't have a pap smear or what's the
Thermography.
There's no reason why we can't make sure that the prescriptions they need for high blood pressure, sugar diabetes, lupus, cancer, whatever that ailment may be, because we have so many diseases, you know, MS, we could just go on and on and on. And then, but when it's at no cost, it makes the difference.
And there are some, but there aren't enough.
Yeah, they're not enough.
You know, Komen does some things to help women, and there are a lot of other programs out there that do too. But what I have noticed is, while Komen may focus on women who are diagnosed in the early stage, and they do that because if you're early stage breast cancer, there's a greater chance of saving a life versus there's 4 stages. So of course, stage 4 is it's metastasized and it's in your organs, it's in your lymph nodes and your bloodstream. But even with those programs, there's one at St. Rose. There are different programs in different places to give you screening support, actual treatment support, but there aren't always enough dollars to go for enough. And even though the concentration of those dollars are in our underserved communities, we still need more.
Absolutely.
And then when the dollars are focusing on the populations in the underserved community, it doesn't mean the services are in the underserved community.
Absolutely.
So now you have dollars being channeled to underserved communities, but then they don't have transportation sometimes to get
there.
Well, we know St. Rose is where?
Where we are not. Okay, as a people.
So St. Roses. I love the Red Rose program, but it's not that if you're an 89106 or 030 or something like that, you're going to be able to get out there that easily.
Absolutely.
And yes, there are transportation services too. So we find a way, but it just, there needs to be more, and that's a whole community
accessibility.
It's a community collaboration sometimes to provide health care to those who are disadvantaged. And
So
how do we do that?
we are winding down. I'm like, this is gone by. Like, you know, you guys have been so amazing. I'm just serious. It is just a conversation. Just the conversation with you three is so enlightening and it's powerful. And I hope that everyone watching will take this and not just hear, but be doers of what you hear. And don't be afraid. I hope we are putting a call to action to you to check on yourself. Take care of you, because it's only one you. So let's start with Shaniqua, and we're going to work our way to Dr. Wells and end with Tanya. What are your final words with pursuing health and wholeness to our audience? What would you say? What's your
Well, I like
final
that you did say it's about you. So we have to be our own advocates in some areas. But if I can use a scripture, I would say that God gave you power and authority over the devil to cure and to heal diseases. I believe that God is basically saying, if I had to use words, it would be that it is okay for you to take control of your own health and move forward because I'm right there with you. And God gave us that promise. And so we don't have to worry when it comes down to health care. If God gave us the promise, you better believe that He's going to fulfill it. So be strong, be confident in executing anything that has to do with health. Get your screenings, whether it's a DEXA scan for like osteoporosis, whether it's a blood pressure screening, whether you're getting your mammograms, your colonoscopies, pap smears. These are extremely important. And if you find that you don't have access, then there's places such as Dr. House's place that they can always contact. There's the American Cancer Society, there's the American Diabetes Association. There's so many things out there that myself, and I'm sure Dr. Wells, would be willing to assist if you just give us a call.
Sure.
We're right there.
Thank you. Thank you. Dr. Wells.
Yes, and like Shaniqua said, there are a lot of physicians and nurses, but like myself, who are willing to donate our time and also, but we can't find the opportunity. There are some places but we are willing to donate that look like us, old FUBU for us, by us. There are a lot of us that are willing to donate our services and our time. So we are willing to do that for our communities. And if I could leave one thing to say, I love what she said. You have to take responsibility. You have to take the lead. Don't be afraid. Start in the kitchen. If you can't afford healthcare, what are you putting in your mouth? You know, that is.
Come on, let's
what are you
talk
putting in your
about
mouth?
it.
We can't be doing fat backs and collard greens and hog maws and all the stuff I grew up on, but I had to learn to get away from. But we have to be careful what we put in our mouth. We can't afford to get the care because breast cancer, these things are multifactorial. So let food be that medicine and medicine be that food. So you can start with, if you can't afford the doctor, put some more greens, put some more fruits and vegetables on your plate. Let half the plate be fruits and vegetables, and let maybe a quarter be a little chicken. Grill it or bake it. You ain't gotta fry it all the time. Don't be fighting.
But there's air fryers now.
There's air fryers, which is they're okay. They're less of evils, but they're not the best. But they're okay. They're better. They're better. We can have a whole nutrition talk on that. But
I know, right?
Yeah. So, but get a team.
That's another panel.
Coming from the vegan with that chicken, I tolerate the chicken, but it's all right. So, but it's a team effort. Don't feel like there's no I in team. Don't feel like you have to do it yourself. And the one thing I will leave you with, if we can change the I for the we can change illness to wellness.
That's right.
Wow, love that. Thank you.
Well.
Thank you. Tanya.
I don't know how you follow that after Dr. Wells, you know. Basically piggybacking off of what they said, but I think keep God first. That is the most important thing. And no one knows you better than you know yourself.
That's right.
So you know your changes, how you're feeling. You have headaches and you never have headaches. It is the slightest thing that is a different thing.
Yes.
If you feel bloated, if you're not digesting food well, if you're anything, all these things matter and they're very important and very significant. So I say don't push them to the side and ignore them. Pay attention to your body.
Yes.
Stay at peace, whatever peace is, and peace is God. So keep God first and know that He is a healer. I will sit here and say I'm a testimony of 20 plus surgeries.
Yeah.
I think I've been under anesthesia about 20 good times.
Wow.
And God is everything.
Yes.
He will deliver.
Yes.
So keep Him first. Keep your peace.
Keep your peace and follow your body.
Follow
Listen
your
to your
body.
body. Shaniqua,
Stress is crucial.
Dr. Wells, Tanya, it has been a pleasure having you here for this panel. And for those that are watching, there's a scripture that says, I wish above all things that you would prosper and be in good health, even as your soul does prosper. So God desires you to be healthy, body, mind, and soul. Thank you for tuning in, and tune in next week for our next panel that we'll have that will also deal with issues concerning women. God bless you.
It's time for us to give. Giving is a part of what we do because He gave. Tithing is 10% of what God has blessed you with. So support the church with that. Support the body of Christ with that. Also give a free will offering. Some of you can give at least $20 or more, but make sure that you are a part of giving because giving also is worshiping. Like this and share this with someone. God bless you. We'll see you soon.